Hi, good day. My name is Kate Roble and I am a student nurse from Section 12J. And today I will be performing an infant resuscitation. So, first step is we need to evaluate newborn's transition to extrauterine life using UPGAR score. And for this time, we need to assume that the UPGAR score or the baby has an UPGAR score of 3, which means that the baby is in need of immediate attention or like immediate help, that specifically that the baby needs a CPR. And it is also this is necessary to differentiate unconscious baby from those who is hypoglycemic and sleeping or in shock. So next is check for responsiveness by rubbing the soles of the feet or rubbing the back of the baby. So baby, are you okay? Baby. Babies' areas sensitive to touch include soles of their feet. Babies can hear fairly well. A loud noise or sudden movement might cause an infant to give obvious responses such as crying and moving. So next, we can use cold blue or doctor's quick so that we can get the attention of the doctors and other nurses. And then this is to signify that there is an emergency situation. And after that, open the airway and suction if necessary using the head tilt chin lift maneuver. So I'm going to use the suction now. Head tilt chin lift maneuver is a procedure used to prevent the tongue obstruction the upper ways. So next, so after that one, positive pressure ventilation using pediatric valve mask is initiated if apneic and bradycardic, or the baby is apneic and bradycardic. So we need to attach BVM to oxygen cylinder with 100% oxygen, assuming that we already attached the BVM to the oxygen cylinder, and then cover the entire mouth and nose with the BVM. So forming a firm seal will prevent a leakage and provide full inflation of the lungs, and provide ventilation every 1 to 3 seconds for 40 to 60 breaths per minute, and we always look for the chest rise with each bagging. Breathe 1, breathe 2, 3, breathe 2, 3, breathe 2, 3, breathe 2, 3, breathe 2, 3. So next, after that, have someone or ask someone to attach the cardiac monitor and pulse oximeter. And after that one as well, we need to do the chest compression if the heart rate is still less than 60 after 30 seconds of PPV. And then use either 2 finger or 2 thumb encircling technique when doing compressions. This allows us for maximum compression for the heart between the sternum and the vertebra. So place compression fingers at the center of the chest just below the nipple. So press down approximately about 1.5 inches. So chest compression and recoil times should be equivalent. Incomplete chest recoil is associated with decreased coronary cerebral diffusion. So provide 15:2 compression ventilation ratio for 10 cycles for if there's 2-man rescuers. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 1. And then after that, let's provide 2 ventilations. 1, 2. And then next, let's continue with the compression. Then after that, we need to evaluate the heart rate after 5 cycles. And if the heart rate is still less than 60, continue the chest compression and assist in intubation and give meds. And if the heart rate is more than 100, process proceed to number 9 step, and which is do post-resuscitative care through monitoring the administered oxygen concentration and arterial oxygen saturation. This is to ensure adequate cerebral perfusion, oxygenation, and supportive treatment to allow the recovery of vital organs. Then lastly, we need to document the time of the procedure, the assessment, responses to the treatment, and medication given. So this is for documentation purposes that the procedure was done, and this is also a means of communication.